September 22, 2017. Chicago. The nation's emergency departments had low rates of complying with recommended HIV and syphilis screening for at-risk adolescents, though larger hospitals were more likely to provide such evidence-based care, according to a study presented during the 2017 American Academy of Pediatrics UP National Conference. Nearly 1 million cases of pelvic inflammatory disease (PID) are diagnosed each year, and 20% of those diagnoses are for females younger than 21. PID is a complication of undiagnosed or undertreated sexually transmitted infection and can signal patients at heightened risk for syphilis or HIV, according to a study led by Monica Goyle, MD, MSCE, Director of Research in the Division of Emergency Medicine at Children's National Health System. Adolescents account for half of all new sexually transmitted infections (STIs), and often view the emergency department as the primary place to receive health care. If we are able to increase screening rates for sexually transmitted infections in the ED setting, we could have a tremendous impact on the STI epidemic, Dr. Goyle says. Although gonorrhea and chlamydia are implicated in most cases of PID, the Centers for Disease Control and Prevention (CDC) recommend that all women diagnosed with PID be screened for HIV, and also recommends syphilis screening for all people at high risk for infection. The research team conducted a cross-sectional study using a database that captures details from 48 children's hospitals to determine how often the CDC's recommendations are carried out within the nation's EDs. The research team combed through records from 2010 to 2015 to identify all ED visits by adolescent women younger than 21 and found 10,698 PID diagnoses. The girls' mean age was 16.7. Nearly 54% were non-Latino Black, and 37.8% ultimately were hospitalized. It is encouraging that testing for other sexually transmitted infections, such as gonorrhea and chlamydia, occurred for more than 80% of patients diagnosed with PID. Unfortunately, just 27.7% of these young women underwent syphilis screening, and only 22% were screened for HIV, Dr. Goyle says. In Children's National Health System-related HIV articles, The Lancet HIV. New HIV infections stagnating at 2.5 million a year worldwide. A major new analysis from the Global Burden of Disease 2015 study, published today in the Lancet HIV journal, reveals that although deaths from HIV/AIDS have been steadily declining from a peak in 2005, 2.5 million people worldwide became newly infected with HIV in 2015, a number that hasn't changed substantially in the past 10 years. Study examines risk of HIV transmission from condomless sex with virologically suppressed HIV infection among nearly 900 serodifferent. One partner is HIV positive, one is HIV negative heterosexual, and men who have sex with men. Couples in which the HIV positive partner was using suppressive antiretroviral therapy, and who reported condomless sex, during a median follow-up of 1.3 years per couple, there were no documented cases of within-couple HIV transmission, according to a study appearing in the July 12 issue of JAMA, and HIV/AIDS theme issue. Current HIV news and events. We have handpicked the best science podcasts for 2017. Sit back and enjoy new science podcasts updated daily from your favorite science news services and scientists. Now playing Radiolab. Oliver Sipple. One morning, Oliver Sipple went out for a walk. A couple hours later, to his own surprise, he saved the life of the President of the United States. But in the days that followed, Sipple's split-second act of heroism turned into a rationale for making his personal life into political opportunity. What happens next makes us wonder what a moment, or a movement, or a whole society can demand of one person. And how much is too much? Your browser does not support the audio element. Now playing TED Radio. Our future consequences. From data collection to gene editing to AI, what we once considered science fiction is now becoming reality. This hour, TED speakers explore the future consequences of our present actions. Guests include designer Anab Jain, futurist Juan Enriquez, biologist Paul Knopfler, and neuroscientist and philosopher Sam Harris. Your browser does not support the audio element.